So again, the detail of that would clearly be a response for Apollo, but in the general sense, firstly, you do not have CCT in patients' rooms. Secondly, any information that is there, even if it were to exist, which it doesn't, you would never release. I have explained to you, I think, that you do not take photographs of critically ill patients. Can you imagine if you or anyone you loved or cared about critically ill in an intensive care unit or recovering was being photographed and their images shared, how would they or you feel? We just do not do that. And I cannot understand why anybody here thinks it would be a reasonable thing to do. It's extraordinary.
Doctor.
Actually, அவங்க fever, dehydration தான் வந்தாங்க சார். அதுக்கு அப்புறம் there was progression of events in her.
சார் இன்னைக்கு வந்து எல்லாரும் மருத்துவ குழுலாம் சந்திக்கிறீங்க. அந்த ட்ரீட்மெண்ட் நடந்தப்போ எந்த டாக்டருமே யாரும் எந்த டீமுமே வந்து என்ன நடக்குது ஏது நடக்குது சொல்லல. இன்னொன்னு லட்சக்கணக்கான மக்கள் அப்போலோ வாசல்லே காத்திருந்தாங்க. கோடிக்கணக்கான மக்கள் என்ன நடக்குதுன்னு தெரியாமே இருந்தாங்க. ஆனா அவங்களுக்கு முறையாக இந்த மருத்துவ நிர்வாகமா இருந்தாலும் சரி, மருத்துவ குழுவாக இருந்தாலும் சரி, தமிழக அரசா இருந்தாலும் சரி, முறையாக நீங்க வந்து அதை நடந்துக்கிட்டீங்களா? அது மாதிரி பல கேள்விகள் இருக்கு. இதுக்கு வந்து நீங்க என்ன சொல்ல போறீங்க? ஒரு விட்னஸே இல்லைன்றீங்க, சிசிடிவி உள்ள வைக்கல அப்படின்னு சொல்றீங்க. நீங்க இந்த பிரஸ் மீட் கொடுக்கறதுனால மக்கள்லாம் இதை நம்ம அவங்களுக்கு எழுந்த சந்தேகத்துக்கு என்ன தீர்வு, எதை சொல்லி நீங்க வந்து இது இப்படிதான் நடந்தது அப்படின்னு ப்ரூவ் பண்ண போறீங்க?
Please, I'm not going to ask Dr. Balaji to translate that so I understand what the question is.
The question is, will this press conference settle the issue that is raging? What was the treatment given to her and what was the disease process, and was there frequent bulletin? Was there did the treating doctors meet the people who are waiting outside and discuss with them or tell them what was there, whether bulletins were issued?
So
that is the question.
I think there are a number. Please. There are a number of separate issues here. Now, you know, I am not from here. I'm completely independent. I was asked to come and provide some help. I was not there for everything that happened, and there are elements of detail that I cannot possibly answer. However, I have a pretty good idea of what the process was. I was there to a large degree at the beginning, and during the period of time that I wasn't, I was in touch from a distance. And I can tell you that the process of care that was followed here was perfectly straightforward. There was no conspiracy, nothing strange happened. As you have heard, she got a severe infection. It was in her blood. It affected her heart. She became acutely unwell. She was brought to hospital. Her condition was stabilized and improved for a while. It then deteriorated again. She was put on a ventilator. She had a lot of supportive care with a lot of input from many doctors. She started to improve. She had a tracheostomy. She was woken up. She continued to improve and have increasing physiotherapy and was doing well and looked as if she was recovering. And then she had an unexpected catastrophic cardiac arrest, as you have heard, and tragically died. That is what happened here.